Welcome, everyone. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHE, the Collaborative for Health and Environment. I'm joined here by my host, Swathi Rayasam, a Science Associate at PRE, UCSF's Program on Reproductive Health and the Environment. I'm really pleased to welcome you to today's webinar on closing the exposure assessment gap. We have an excellent group of speakers today, and I hope that you'll find the information that they'll be sharing to be useful in your work. This webinar is co-hosted by PRE's Science Action Network, UCSF's Environmental Research and Translation for Health, or EARTH Center, and CHE. A few bits of housekeeping as we get started. First of all, please feel free to put a note in the chat introducing yourself if you'd like to do that. And we look forward to your comments and questions. Please type your questions in the Q&A box at any point, and we'll get to as many as we can after the presentations. If you're joining by phone, you can download some of today's slides from the webinar page on our website at healthandenvironment.org. And for those who are online, we'll put that link in the chat now. If you'd like to activate closed captions, you can do that by clicking the button on the bottom of your screen. This webinar is being recorded, and it's scheduled to last for an hour and a quarter, although we may wrap up sooner than that. And now I'll turn it over to Swathi.
Good morning, everybody. My name is Swathi Rayasam, as Rachel introduced me. This webinar is the first in a two-part series in which we're highlighting and building upon a series of studies that UCSF published earlier this year with an interdisciplinary group of scientists and experts from EPA and community organizations and NGOs, and including EPA veterans. These papers recommended improvements on how science is used in decision-making to prevent harmful chemical exposures. I'm pleased to begin by introducing our moderator and a good friend of mine, Jonathan Kalmuss-Katz. Mr. Kalmuss-Katz is a supervising senior attorney in the Toxic Exposure and Health Program at Earthjustice, based out of Earthjustice's Northeast office in New York. His work focuses largely on the regulation of toxic chemicals and pesticides under federal and state law, including the Toxic Substances Control Act, or TSCA, and the Federal Insecticide, Fungicide, and Rodenticide Act, or FIFRA. Earthjustice's Toxic Exposure and Health Program uses the power of law to ensure that all people have safe workplaces, neighborhoods, and schools, have access to safe drinking water and food, and live in homes that are free of hazardous chemicals. The program works to ensure that regulators acknowledge and redress the inequitable burdens imposed on Black, Indigenous, and people of color through manufacturing, use, and disposal of toxic chemicals. So I'd like to invite John to get the conversation started right now, so I'll turn it over to you.
Thank you so much, Swathi. And it's a pleasure to be here. Thanks to CHE and to UCSF and to everyone who helped organize this panel. I'm going to try and be brief because we have three amazing panelists today who are engaged in really interesting and important community-based exposure research, and I want to leave as much time as possible for them. But I'll begin by providing just some brief context for today's webinar, starting with why exposures and exposure assessment matter from a legal and regulatory perspective. And the main reason why that's the case is because almost all federal environmental laws regulate pollutants and chemicals based upon findings of risk, which means in order to prohibit a chemical or pesticide, to list a hazardous air pollutant, to establish cleanup requirements for a contaminated site, the regulatory agency, often the Environmental Protection Agency, sometimes the Food and Drug Administration, has to find that the substance presents unreasonable or unacceptable risk. It doesn't need to be that way. Risk-based regulation is often used to delay and to weaken public health protections and to exclude impacted populations from the regulatory process. And there is a lot of work that is ongoing to change that system. Various states and international bodies are regulating chemicals based on their hazardous properties without the need for detailed exposure assessments. But right now in the United States, if federal agencies want to take action to protect the public from harmful chemicals or pesticides, they typically need to do so based upon a risk assessment. And if you're talking about risk, you're talking about exposure. Exposure is really half of the risk assessment process. Risk assessment is generally, or risk is generally calculated by combining a substance's toxicity, or the dose at which a chemical or mixture of chemicals causes harm, and the level of exposure to the chemical or chemicals. For many kind of widely used, widely studied chemicals like phthalates, flame retardants, chlorinated solvents, the toxicity is well established, and there's pretty broad agreement about their dose response curves. So while there will be kind of some debate over whether a particular study is relevant or the interpretation of certain data, I think generally the toxicity side operates within kind of a narrower range of kind of debate, at least kind of legitimate debate, whereas the exposure side is much more wide open. There's very little good exposure data for many of the chemicals that we're exposed to every day. And therefore, kind of if industry wants to challenge an agency's risk finding, if they want to weaken the regulation for a proposed rule, the place they start is often by trying to kind of affect the exposure analysis to kind of reduce the estimated exposures and therefore weaken the findings of risk and avoid or weaken the regulation. If we can go to the next slide, please. And unfortunately, despite its significance, federal agency exposure assessment practices are generally deeply flawed, and there are a number of reasons for this. One is, as I mentioned, there is very little monitoring and biomonitoring data available for many of the chemicals that we're exposed to. And that leaves gaps that are filled with kind of self-supplied industry modeling and estimates. There was one chemical that was undergoing evaluation under TSCA, a chemical called pigment violet 29, which is manufactured at a particular facility in South Carolina. It's the main domestic manufacturer. The Environmental Protection Agency that was charged with preparing this risk assessment had absolutely no information about worker exposures. And in order to get that information, they wrote to representatives of the company Sun Chemical and asked for the information. Sun did not provide any monitoring data. What Sun provided was essentially a one-paragraph email saying, here's the average exposure over a workplace or over a workday. And EPA asked for support for that. Kind of EPA asked, great, all right, kind of let's see kind of what is this based on? Can we see the underlying data where you're monitoring kind of records? EPA got none of that. Sun really was completely non-responsive. And in the end, EPA conducted its initial risk evaluation based upon just this one sentence from the chemical manufacturer about what the average exposure was. The other thing that the absence of good monitoring and exposure data does is it leaves agencies highly reliant on underprotective default assumptions. So when the Environmental Protection Agency is calculating risks from exposure to chemicals in kind of the food supply and fish, they will assume a certain number of meals per week, per month, per year. And those assumptions often don't reflect the practices of indigenous populations and people who operate on a subsistence diet who are more reliant on kind of contaminated fish for either cultural or dietary reasons. And similarly, when EPA is evaluating the impacts of chemicals in drinking water or the air, they typically assume that people are going to be in a current residence, in their residence, for 33 years. And the agency calls that a conservative assumption. They say that's protective because they say most people don't actually stay in an apartment or a house for that long. But we know that that also depends a lot on income and race and location, and the assumption that everyone's just gonna get up and leave, gonna move after a couple of decades just doesn't play out in reality. People that live in fence-line communities often live there for their entire lives. Agencies have very little ability to detect many chemicals in the environment, and this has become a particular issue with respect to PFAS chemicals that are widespread in drinking water, and other environmental media, where we know the chemicals are being released and we know that people are being exposed. But because we don't have what are known as analytical reference standards or analytical test methods for many members of the PFAS class, we're not actually able to detect the chemicals, which leaves us unable to meaningfully regulate them. Agencies often fail to consider aggregate exposures across multiple exposure routes and pathways. So this is somebody that is exposed to the same chemical in their air or their drinking water, or kind of in their homes from products and from their job at work. And there's a great graphic on this slide that I think illustrates this. It's taken from a paper that was actually authored by Swathi and others at UCSF's Program for Reproductive Health and the Environment. And it shows the way that people are actually exposed, where we're exposed to the same chemicals and to other chemicals that cause similar health effects from multiple sources, from multiple pathways, from multiple routes. And then agencies, when they're conducting their exposure assessments, look at each one in isolation. And similarly, in addition to failing to consider aggregate exposures, agencies fail to consider cumulative exposures to multiple chemicals and non-chemical stressors that affect how kind of those exposures are causing harm. And if we can go to the next slide, please. And I think this is all coming to a head in kind of the ongoing risk evaluations that the Environmental Protection Agency is conducting under the Toxic Substances Control Act. And in particular, the 7 risk evaluations that EPA is conducting for phthalate chemicals. Now, these are endocrine disrupting substances that are commonly used in plastics. They're plasticizers. We know that people are often exposed to multiple phthalates from multiple sources, and that they have cumulative effects. They kind of collectively all kind of cause the same harm, reproductive harm, often neurodevelopmental harm. And women of color, because of their uses of products that contain phthalates and other chemicals, often have the highest levels of exposure and the highest levels of phthalates in their bodies, in their biomarkers. And yet EPA, which is charged with evaluating the risks and regulating the risks posed by currently 7 phthalates, admits that there's a lack of data for all phthalate in environmental media. So EPA, while it has really been kind of conducting these evaluations now for years, says we still don't have the data that we would want and need to fully evaluate these exposures and risks. And I think if we can go to the next slide, and this will be the last one for my introduction. Given those gaps, I think kind of there is a need for just kind of new approaches and really kind of concentrated emphasis on how people are being exposed to toxic chemicals in their environments and their products, and the disparities in those exposures. And all of our panelists today, and it is a really impressive and accomplished group, are conducting research on that. So I will briefly introduce the 3 speakers who we hope to have with us today. I know that some will be joining later in the presentation, and then I will turn it over to them. But I wanted to begin with Dr. Bhavna Shamasunder, is an associate professor and the chair of the Urban and Environmental Policy Department at Occidental College in Los Angeles. Dr. Shamasunder teaches and conducts research at the intersection of environmental health and justice, with a focus on inequalities in chemical exposures faced by low-income communities and communities of color who live and work in urban environments. She's researched the health impacts of oil drilling in Los Angeles and the toxic effects of chemicals and cosmetics and personal care products. And she is a principal investigator on the Taking Stock study, which she and Dr. Williams will be discussing today. And that study explores the impacts of beauty products on Black and Latino women in California. Dr. Astrid Williams is the manager for Black Women for Wellness's Environmental Justice Program. She has a wide range of experience in chronic disease, maternal and reproductive health, and is particularly passionate about women's health issues. A significant portion of her work involves developing public policies that address community-level health and social issues using evidence-based practices. Throughout her career as an administrator and leader in public health, Dr. Williams has coordinated numerous programs, and she holds a doctorate of public health and a master's of public health in health promotion and education from Loma Linda University School of Public Health. And then later in the presentation, we will also be joined by Dr. Micaela Martinez, who is the Director of Environmental Health at We Act for Environmental Justice in New York City. Dr. Martinez leads the Beauty Inside Out campaign, which surveys uses of and attitude towards chemical hair relaxers and skin lighteners among femme-identifying people of color in Northern Manhattan and the South Bronx. An ecologist and environmental justice advocate, Dr. Martinez earned her PhD in ecology and evolution and previously served as an assistant professor at the Columbia University Mailman School of Public Health and Emory University. Her research focuses on infectious disease ecology, social justice, climate change, maternal and infant health, and environmental impacts on health. And with that, I will turn it over to Dr. Shamasunder.
Hi, good morning, everyone. Thanks for joining us wherever you are in the country. I see there's so many people on the Zoom. So I'm going to share my screen and can everyone see that? Yes? Thumbs up? Okay. If you have any troubles, please interrupt me and let me know. So I'm going to be talking about the taking stock study and focusing on the problems that Jonathan laid out on exposure assessment in particular, and doing it through a case study of community-based research that's ongoing in Los Angeles from 2018, and it's ongoing today. I have lots of co-authors and collaborators on this project. And we're talking about this work in lots of formats. So I'll talk about a little bit about it today, and then you can catch us in other places as well. But I'm focusing here on the problem statement that is laid out in the specific paper on exposure in the Strengthening the Chemical Regulatory Process project that UCSF, the Program on Reproductive Health and the Environment, has put forward. I highly recommend reading the 4 papers. They're really interconnected, but the problem statement that we're looking at is that there are many sources of uncertainty in exposure assessments, as we heard already, and when these uncertainties lead to underestimates of human exposures, risk assessments are problematic and poor, especially in vulnerable contexts. So our goal is to improve these, and we are seeking to improve these in the context of an increasing number of chemicals that are released into the environment. So I work on oil drilling, as does Black Women for Wellness in Los Angeles, which is one of the largest urban oil fields in the country. And we also work on consumer product exposures, which we'll focus on today, but the communities that we work in are vulnerable environmental justice communities that are multiply burdened and impacted. And we struggle with this problem of single evaluation of chemicals one at a time, replacements that are regrettable, not knowing what chemicals are in products or used in oil drilling. These things are kept secret sometimes as confidential business information, and there's an absence of chemical standards. So in the face of all of these big and mounting problems, we undertook the Taking Stock study. That is a community academic partnership that's led by myself and Black Women for Wellness. And I'm primarily a community engaged environmental justice scholar, which means that I situate my work in environmental justice frameworks. I work in partnership with frontline communities that are most affected by a problem or an issue. And our research studies always begin with a community-led question. And we develop studies that try to answer these questions in the best ways that we can through rigorous data collection. So the Taking Stock study is built on these building blocks of very downstream data that we already have. So we know that women of color are disproportionately exposed to consumer product chemicals. We know that this from NHANES data, biomonitoring studies that have happened in multiple formats across the country. And we know that many of these chemicals are endocrine active. And exposures are associated with hormone-mediated health conditions, breast cancer, uterine fibroids, adverse birth outcomes, and respiratory harm for immune system reactions. So our problem here is that when there is no data, we see that there's on product use, which is where we are starting, is that the documentation of product use among diverse women is limited. And so we often hear we don't know what women are using, and it may not be the drivers of health disparities. And so corporations use this to say that there's no data, and then it becomes a space for regulatory inaction. And then it takes resources and what has been for us a big interdisciplinary team to work towards finding the answers to a question, which here is an inventory of trying to figure out what are women actually using. So this is our research team. We are spread around the country at many institutions, and this is some of us as we got together for a beauty justice conference at Columbia this last fall. Our work is place-based and community grounded, so it's empirical, but has implications for the industries and political structures in which it operates. So we work in LA County and city, and we focus primarily in South Los Angeles. South Los Angeles is recognized by the state of California as an environmental justice community. The designation comes from the Office of Environmental Health and Hazard Assessments, CalEnviroScreen, and it combines social and economic data with environmental data, and South LA is in the top 5% of the most heavily burdened communities in the state. So there are freeways, there are oil fields, there's lots of place-based burdens in this community. And in this context, we've also been asking a lot of questions about consumer products. Where do consumer products fit into the landscape of exposure in this vulnerable community context? So I won't spend a lot of time on this, but the study that we've have undertaken has been in 3 parts. I'm going to skip aim 1. The data from this was a statewide study survey of product use among all California women across race and ethnicity. Part of it is published in a paper that Robin Dodson led from the Silent Spring Institute, and you can read it to know what we learned in our statewide study. I'm going to focus here on aim 2, which is the community-based portion of the study that is looking at product use patterns among Black women and Latinas living in Los Angeles. So what did we do in this study? We have developed a method which is our answer to getting better and more detailed data among the products that women are using, because we think there are misrepresentations about how many products people are using, how often they're using them. And we're trying to get a deeper dive into doing better exposure assessments here in a community setting. And we had to create this tool because we didn't have anything. And we did it on a smartphone, and it's an app, the Taking Stock app. And I will say that the study we did undertake was during the pandemic. So our data is maybe different than if we did it again today. We are continuing parts of the study, and we'll do some of this again. So we'll check, but this study was done with 35 women who are identified as Latina, 35 women who identified as Black living in South LA. They scanned all of their products in their house, took a baseline survey. Over the course of the week, every time they used a product, they scanned it again. So we have both an inventory of what they have in their house and what they use every day over the 7 days. At the end of the 7 days, they gave us a urine sample. So we have a biomonitoring sample. So what did we find? So we found that there were 6,000 logs across 70 women. There were 1,200 unique products logged, means that they were not the same products that women are using. So 1,200 different products and approximately 11 products per day. We don't think that this necessarily replaces the environmental working group number that has been out floating around for a long time because of the pandemic context, but we do think that it's a lot of products, and we have a potential here for real exposure misclassification when we're not documenting exposures among consumers who purchase and use everyday personal care products. So the sheer variety of products and the number of products, even within a category, and the fact that there's really little overlap among participants in product use is a real challenge. So for example, there were 95 different body lotions that 50 women documented. And we see that there is a different number of products logged by different women per day. Some use less, some use more. This probably changes over time as well. for each individual woman. So what did we find? We found, so this is 1,400. So we've had a range from 12 to 14. I actually recounted, I can change the slide, but the thing I want to point your attention to is that the greatest brand variety were within these products. So face creams, moisturizers, body lotion, hair oil, and body oil. There's not very much brand transparency and product transparency. The market's flooded with similar products under different names. So, when one name becomes associated with higher chemicals or adverse outcomes, these can simply be replaced or pulled from the shelf and put back in under a different name, and it becomes a market challenge. Labels are not easy to read. We scrape the ingredient data off of every single product that we scanned. And I'll note here and pick it up later that we didn't find orthophthalates reflected in any label that we scraped. And I'll talk about this more in a minute, but when women try to move to alternative, healthier options, this becomes a problem. And this is particularly because products look very different. And so here's two products that are lotions in our study. And, many environmental health scholars have focused on swapping one product for the other for this reason. You could teach participants to do this, but I will argue that there are critical limits to this approach, which we can discuss, but these include the availability of the product in your location, the ease of label reading, potentially missing ingredients on labels, and cost. So, but we see this huge variety. We also had a biomonitoring portion of our study, and some preliminary data is that we've actually found personal care product chemicals in everyone. And these varied. We found phthalates, parabens, bisphenols, and these varied among Black women and Latinas. We had a really highly educated Black population, which Astrid will talk a little bit more about recruiting, but everyone had them. Our Latinas tended to have lower educational levels and lower incomes, but everyone had them, whether they tried. And in our survey, we asked whether they tried to avoid some of these products. And even when people tried to avoid products, we found them anyway. So, and I'll show you one of the things that are important is that not all, we can say not all lotions are the same, and there's a variety of products. There's also these co-exposures. So people are exposed, and here's our phthalates correlation matrix, and women are exposed to more than one chemical and more than one phthalate at a time. And so this is, for example, MBP and MIBP have a correlation of 0.9, which is rather high, and the same with MEOHP and MECPP. Sorry, it's hard to see, but and some of them have little or negative correlation, but what we see is that there are these ubiquitous co-exposures that are not captured in risk assessments. And we also tested some of our products, and most of the women in our study are using products with health concerns. So there's a potential for exposure. And as I said, we screened all the available ingredients on the list. We didn't find phthalates, but then we found them in our biomonitoring samples. So looking at ingredient lists can help identify some chemicals, but these phthalates that we are finding in women could be coming from another exposure source, or that's poorly regulated, or where there's a lack of information. So the other thing is that in our earlier survey work, we found that 70% of women preferred products that are fragranced, which is an important category of concern. We're doing more work here to understand whether when women try to avoid fragrances, whether they can, because it's also hard to read on the label. So with that, I'm going to turn it over to Astrid, but I'm going to note that data gaps, where we often operate, such as limited public information with products bought by women of color, have been poorly tracked. And there's been almost no regulatory action here. Women of color tend to use more toxic products that are marketed to them. These include skin lightening creams, hair straightening products, douching products. We've written a little bit about this in an earlier paper, but and women are using multiple products. There's co-exposures, not all products are the same. And agencies really can use better science, more available science to improve personal product marketplace and better protect consumers. We think that community level efforts in the meantime are a vehicle to closing gaps in exposure and educating our communities, and in the hopes of working for larger scale policy change. So with that, I'm going to turn it over to Astrid, and I'll keep advancing the slides for you, Astrid.
Thank you. Thank you so much, Bhavna. Thank you for the transition. Also, thank you, Rachel, Swati, John, and Christian for having us to be able to share. And so I think this is a smooth transition in talking about the community and how it can be a readable solution to looking at this problem. Black Women for Wellness, we are a community-based nonprofit located in South Los Angeles, and we've been around for a number of years, since 1997, so well over 25 years. We're a 501c3 that allows us to do a lot of this grassroots level community-based organizing and advocacy, as well as we have a C4, which allows us to do more of the policy work. So here you can see on the right are a list of our programs comprised of the different things that we engage in, from community-based health education, broad-based civic engagement, as well as our reproductive justice, which we are deeply rooted in. And oftentimes we get the question is, how does environmental justice fit into this equation or to the discussion? And a lot of it intersects. And so it's interwoven in the work that we do, but also in the environment. And so we like to say how the environment where we work, live, and play has a lot to do with the products that we use, the neighborhoods that we live in. And so we just wanted to bring it, full forward. And so our environmental justice team is small but mighty. It consists of myself as well as our environmental justice program lead, Tiana Shaw Wakeman. And we like to look at the work in two buckets. And so we have the built environment, which largely looks at the water equity issues in terms of sustainability, affordability, and equity in terms of water quality. And then we, as Bhavna shared, very engaged in the neighborhood oil drilling work, largely around the Inglewood oil field, and being able to look at how it has greater impacts into overall health and wellness. And then in its infancy stage of plastics, because it all, is a holistic approach in looking at where, oil and gas are being drilled, and then production of various things such as plastics, and then looking at it in the life cycle. But what we're here to talk about largely here today is our beauty justice initiatives. And so we've been engaged in this probably since around 2014, and started the environmental justice movement off of looking at personal care products that are targeted and used largely by women of color and Black women. And so we engage in research, our taking stock study, which Bhavna shared, on, as well as our empowerment. We do this through our community engagement, such as Curls and Conversations, which I'll touch on. And then lastly, our advocacy efforts through co-sponsoring bills such as the Safer Beauty Bill package. So, next slide. And so where Bhavna left off is talking about the quantitative. And so we bridged that in with the qualitative. And so we did a series of workshops, or focus groups, where we met with the participants in the study. So we hosted 3 with our counterparts in the Black community and 3 in the Latino. 2 of those were adult-based groups, and 1 we thought it would be great to see what the youth are, think about the issue as it unfolds and beauty justice. And so that was actually very interesting as well, to be able to interview the adolescents and get their take on a lot of these products and what it means to them. But I'll be sharing on the adult focus groups. And so we had participants that engaged in this. And so you can see here some of the general themes that we focused on, such as skincare, hair care, looking at societal influences, cosmetics, intimate or personal care, and how that relates to appearances. And so these were the broad themes. And so the next slide, I'll get into, what that looks like and what we found. And so from the qualitative and asking them questions and being able to engage with them in this lively discussion, we saw these major themes come up. And so here, as it notes, and so going over some of the bullet points here, is that Black women as a whole largely felt the societal pressure to be able to look presentable, and this was at all times. And so not only in professional settings, obviously in the workplace, for advancement in their careers and opportunities, they felt that need to straighten their hair to conform to societal standards and what that may look like for them, but also in their personal lives as well. Bhavna shared a little bit about the constructs in terms of, looking at the study and what that means. And so colorism can be one of those, as well as texturism, looking at, one's individual hair textures and their preference towards, straighter hair versus kinkier textures. And then lastly, odorism. And so looking at the smell of individuals and being able to have the need to, use a lot of these products that are highly fragranted with scent. We had one participant, or largely one, a lot of them, but one in particular stated that she frequently, reapplied deodorant throughout the day for fear of, smelling, or having a particular body scent or odor among her colleagues. And so this is something that was very, critical in her life, and, how, that she shows up and represents. Also, women were aware, as Bob stated, our population is highly aware and engaged, which is a great thing. Our toxic levels are, above the national average, which is great. However, they are still, some of them are still using the products, not for lack of knowledge. And so how can we switch that, pendulum where, not only they're knowledgeable about it, but they're also wanting to, take action in that. And a lot of them do, but then, it goes back to this, social constructs about, having to, show up in a particular way. And so when we touched on, chemical, hair relaxers, personal or intimate care products. Some of them, feeling the need that, sanitary napkins versus tampons, because this is the way they were, societal, or, culturalized in their own individual homes that, to, use certain products. So they, have, as adults, tended to gradually, start to transition to, other, alternatives, which is a great thing. And so that's what we like to be able to see, a movement or momentum, in that regard. And so a lot of these issues are, intricately tied to the need to be able to show up in a particular, manner. And so hair dyes was also equally something that was, noted. And there have been studies, I'm sure you've noted, sister studies, also NIH came out with one in particular last fall that showed the use of hair dyes in uterine cancer and breast cancer also. And so using hair dyes, and particularly those that are more pigmented, and the frequency can definitely have reproductive harm in terms of breast cancer and different types of cancers in the reproductive organs. And so older women noted as well that they heavily use scent, and showing up in society, as we like to say, when you feel good, you look good, and sometimes having the fragrance and all the heavily scented cosmetics can aid in that, but also it can also be counterintuitive in terms of the phthalates and also other endocrine disruption, reproductive harm that it can present. And so education, and also how do we switch that to be able to use these products, but use them that are more clean and safe, or either reduce the load that we have, because it can be accumulative, not only just in the products that we use, but as we say, in the larger environment. So how can we look at this, in a greater, scheme? And then lastly, skin lightening products as well. So Bhavna and Ami also have done work in this, and looking at how to look at this problem to be able to find solutions. So in the next slide is where we get into community advocacy. So having these talks with our community, and so a solution often comes up. Well, it's easy enough to just swap out the products that you use for a cleaner, or either doing a clean swap where gradually look at the products and slowly start to introduce cleaner, but that is only on what we say surface level. Yes, it's great to do that, but if we look at it in terms of environmental racism, and societal, standards, and how a lot of these harmful, practices or norms in terms of, like I mentioned, showing up with your hair looking a particular way, and also, the accessories that you use. And so whether it be skin lightening creams or either, other types of products. And so we engage in these efforts through working with hairstylists, which largely service our, community. And so we have multiple campaigns, but note here is our Behind the Chair campaign, where we do education and resource around beauty professionals and hairstylists to be able to educate them and also provide information to their clientele as well, to be able to protect them in their work that they do, because it's more chronic versus with their exposures, I would say, with their use of the chemical, products and services that they provide, as well as opposed to you and I, who may go in more infrequently. And so being able to engage in the discussion to be able to support them, how they can, provide more, information around protective styles, but also reading labels for the products, choosing, more green ingredients in the chemicals that they use. And we do this through our quarterly convenings, such as Curls and Conversations, where we have our beauty professional, and they are the expert, and they engage with their audience, and it's been really well received. And so we, look forward to doing those. Notably, we do these, around Women's History Month, also Hairstylist Appreciation, uplifting the work that we do. And so it's been really great. During the COVID, as you can imagine, this industry was heavily impacted. So we were able to provide many grants to the hairstylists or beauty professionals during that time to aid in, financial means during that time. And so with that, the Taking Stock program, we've been able to assist largely and make momentum in this regard. So much for that we were refunded with our Taking Stock 2.0 is what we're, naming it. And we're going to largely focus on hair. So as I mentioned before in the focus groups, we had such a really great discussion around hair, revolved around that. So we, felt the need to be able to uplift this work, and so seeing how we can have, healthier transitions away from chemical straighteners or, chemicals and toxins in products, to be able to, offer solutions in regards to natural hairstyling and to decrease the toxin load for individuals. Next slide. And so just to note some of the efforts that we're doing on the community level at Black Women for Wellness. We're based in California, as I mentioned, but we do work on the local level. So working a lot with our, assembly members, our council members at the state, and some work at the federal level, as we will note here. So we are a part of a coalition that has co-sponsored the bill HR 5540, which is a part of a bill suite of bill, and focusing on this one here, which was one of the 4 bills, which was safer protections for women of color. And this is because you have 2 great populations here that illustrate the needs. So women of color, as we've been, talking about on this talk here, how we are affected largely about the products that we use and that are, available and that are marketed to us, as well as the beauty professionals. And so these are 2 vulnerable populations. And so being able to uplift this work and find solutions to be able to advocate and regulate. And so the HR 5540 is a bill that is suited and well, room to be able to hopefully get through the channels that may be to be able to have, consumer products on the market that are safe for us all to use. And then the second one here is safer protocols around salon workers. And so we've been a part of a study that just recently came out in March of this year, earlier this year, which is Exposed, which is a salon labeling report that was in collaboration with Women Voices for the Earth and the California Healthy Nail Salon Collaborative. And so being able to see, some of the toxins and chemicals that are contained in salon grade products that are used. And so again, to note that they are impacted greatly around this, work as well, and to be able to uplift that. And then lastly, we were engaged in the Crown Act, which was the first bill that looks at, hair discrimination. And so with that, we worked with numerous other partners and allies to have California as the first state in the US to pass this law that, cannot discriminate based off of hair. And so Governor Newsom within Senator Holly Mitchell signed that into bill into act. And so we still have work to go. And there's about 23 states out of the nation that have signed the Crown Act into law. So we want to make sure that, everyone has, equal access and playing field, because that can, relate back to, your employment and having fair employment and equity in terms of, being able to show up and represent who you are in your most natural sense. And, if that's your hair, to be able to support that without fear or, retaliation or harm for that. So those are just some of the examples of the work that we've engaged in at the community level. So some slides on this, or resources on this slide. Here are the Campaign for Safe Cosmetic, which is houses the Black Beauty Project. So I encourage you all to look at that. It has over 70 brands, Black-owned beauty brands that have their products that have been fully vetted, for chemicals of concerns, where upwards of 200 there's chemicals that have been looked at in terms of endocrine disruptors, phthalates, parabens, neurotoxicity. And so it's a really great resource as well. We have a lot of, tip cards and resources that consumers can use, but also businesses or those that are engaged in the field can use that, as well as EWG, which Bhavna referenced before. It's an app, and Claria, which is a great one. It's a add-on browser. So when you're shopping online, you can cross-reference the product and its ingredients. And they just added a new feature just earlier, a couple of months, if not last month, I think, where you can actually take a picture and screenshot. And so it'll take you, directly to the database to see what those ingredients are contained in there. And then some other resources, Silent Spring Institute, which is one of our partners that we work with on the Taking Stock study. They've created an app in addition to our Taking Stock app that their partners have used, which is Detox Me. So broad-based consumers or individuals can use that and go online again to cross-reference, products, ingredients, and then other partners that we have here, Women Voices for the Earth. And so just really glad and fortunate to be able to share this information with you all to see how we can make greater strides in reducing the harmful chemicals that are contained in a lot of these consumer products that are used. So thank you. This concludes the presentation here, our contact information. I think we're going to turn it back over to you, John, to open it up for some Q&A and to turn it over to Micaela, which is actually where they're hosting us today. I am in New York at We Act, and so so glad to be in community with them. They are our sister organization here in New York that does a lot of the similar work. So I'll turn it over to you all.
That sounds like a great transition. And Dr. Martinez, we did your introduction at the outset. So I just will turn it over to you if you want to take over from here.
Oh, okay, wonderful. Thank you so much. So let me get my slides up to share. So I saw that there were questions in the chat, or were we saving those for Astrid to do them after my presentation?
We will have an opportunity to address some of those in the Q&A period.
Oh, okay.
If you want to do
I
your
just wanted to
presentation.
make sure I wasn't taking away from her Q&A time. Wonderful. So thank you so much for having me today. I just wanted to take a few minutes to share a little bit about the work we have ongoing at WEAC. So WEAC is an environmental justice organization. We have an office in Harlem in New York City, which is where I'm based. And then we also have a federal office in DC. And one of the campaigns that we have ongoing is called the Beauty Inside Out campaign. And the Beauty Inside Out campaign is really to try to tackle two of the big issues when it comes to beauty justice. And here I put together this little image to try to kind of frame the issues that we're facing. And I know that the other speakers had hit on some of this. But really, when it comes down to it, is that the problem is that we have these two harms that are done by kind of the beauty industry. One is toxic chemicals can cause physical and biological harm to our health, but then also the racialized marketing and kind of targeted marketing practices can cause not only physical harm to our health, but also societal and psychological harms. And so as part of the Beauty Inside Out campaign, we're really trying to address these issues from both the top down and the bottom up. And so what I mean by that from the top down is really to look at ways that we can improve regulation and legislation to get these toxic chemicals out of our beauty products, but then also bottom up solutions, which is really kind of grassroots efforts in terms of education and movement, social movement, and public discussion to be able to target some of these issues. And I think one of the kind of most obvious examples of this is when we look at mercury exposure from skin lightening products. And we've seen in other countries that have banned mercury containing skin lighteners or even skin lighteners overall, even though there's like the top down approach where legislation and regulation can be put in place. If there's still demand of these products within communities, then you can essentially have an underground market for some of these most dangerous beauty products. And so this is why we think that both the top down and bottom up approach is critically important. And the other thing that I'll say is we are a community-based organization, and extremely harmful products are very readily available in our communities. This picture here on the right is a picture of one of our beauty supply stores that's just about 3 blocks away from my home in Harlem. And you can see that in this whole window is just showcasing skin lighteners. And as I mentioned before, skin lighteners are kind of notorious for containing some of the most harmful chemicals, including mercury, hydroquinone, and corticosteroids. And then here, just a highlight, I did just a really quick search and screen cap on Amazon for hair relaxers. And this is really and these are like the top hits on Amazon. And this is really showcasing targeted marketing practices. You can see that all of the models that are shown here on these boxes are all Black models. And we also now there's plenty of research showing that the formaldehyde that's commonly found in hair relaxers is linked to increased risk of hormone-sensitive cancers, with some of the most recent work showing that link with uterine cancer. So these highly racialized beauty norms and toxic chemicals are a very kind of salient issue within our community. And I'm just going to touch on this just very briefly, that not only are these products readily available, but people are being exposed to these products because they are used quite regularly. So WeAct had conducted a study of 297 femme-identifying individuals from our neighborhoods in Northern Manhattan, and found that 25% of respondents had used skin lighteners at some point in their lifetime. And so this really shows the prevalence of this use. And then also 44% of responders had used chemical hair straighteners. So these exposures are actually occurring. But one thing that I wanted to note is that products, there actually is opportunity to kind of make headway when it comes to product safety. There was a study conducted last year by the Lake Research Partners, which actually found that product safety is a bipartisan issue in the United States. And so 49% of people, of the 1,200 registered voters that were in this study, had believed that consumer products, and this is food and beauty products, 49% of people believe that these are already tested for safety before they hit our stores. And so this is not the case. We don't have these tight safety regulations in the United States. But once people were made aware that these safety regulations don't exist, 90% of people, and this again, both Democrats, Republicans, and independent voters said that they support safety requirements to be in place for products in the United States. So this really highlights the fact that we can do advocacy in this area in a bipartisan way. And I only have, I think, like total of 5 minutes for my talk. So I just wanted to just mention a couple of things that we're doing in terms of advocacy here at We Act. So along with several of our partners, we are working to support a new amendment to the Minamata Convention, which is the International Treaty on Mercury. And currently, there's a ban of cosmetics that contain mercury, a ban on import and export into the United States, but these products still get into the US. And so we are actually supporting this amendment that would also ban the advertising, the display, and the sale of cosmetic products that contain mercury. We also are supporting the Safer Beauty Bills package, which Astrid had mentioned. And this is critically important because there's a set of 4 bills, and if these bills were to be passed, it would increase research and resources about toxic chemical exposure, particularly in communities of color and salon workers who are oftentimes women of color. And then at the state level, one thing that I would want to highlight is that because of the new modernization of cosmetics acts, the MOCRA Act that was passed last December, there are now there are preemptions of state laws to increase safety or adverse event reporting when it comes to cosmetics. And so this is something that we're trying to further discussions about and just raise awareness of, that we would like states to be able to have the ability to strengthen their restrictions when it comes to cosmetic safety. But because of new federal laws that have been put in place, it's actually restricting some of the state power. And I will jump through these 2 slides because Astrid already mentioned some of the kind of latest and greatest for transitioning to non-toxic beauty, and that includes the Clearia app is very helpful, and then also the Black Beauty Project. And with my 1 last minute, I just wanted to say something that we're starting to further discussions about is diversity within the beauty justice space. And at We Act, one of the things that we're actively working on is trying to include cultural complexity, both domestically and internationally, when it comes to beauty justice, and recognizing that different cultural backgrounds and ethnic groups can experience quite substantial differences when it comes to the targeted marketing strategies that are used against them. Also, there can be generational differences, from, the pressures that mothers may have faced in terms of societal pressures and targeted marketing around beauty can be different from, let's say, a younger generation. And so this is something that we're also trying to have discussions on. And I think lastly, one thing that's also very important for this group, especially when we're talking about phthalates, is considering gender, sex assigned at birth, and also gender identity when it comes to the exposure to these endocrine disrupting chemicals, and then also the reproductive health implications. So this is also an area of research that we're trying to expand out on. And so with that, I will hand it over to the panel.
Thank you so much, Micaela, and to everyone for their presentations. That was incredibly informative and really great. And we have 15 minutes now, I think, to address some questions, including some that arose in the chat and the Q&A. And instead of assigning them to a particular person, I will pose the question, and anyone that wants to respond, please feel free to do so. One question that came up in the chat was about whether there have been opportunities for product testing to compare what was stated on a kind of cosmetic products ingredients to what is actually kind of found kind of in a lab. And I know that Taking Stock study mentioned comparing the biomonitoring data, what was being seen in kind of the urine or kind of metabolites of people that are using the products. Are you aware of any efforts to kind of do that comparative testing to kind of actually try and verify kind of what kind of is and is not being listed on a product's label?
Yeah, so we only had the money to test 20 out of, I mean, I think we were somewhat alarmed, or I was, at the 1,200 products, because we had a budget for some testing, and that some testing was really small. So we did test 20 products. We focused really on hair products, and we're still going. We did targeted and non-targeted testing. We didn't find some of the things that we're talking about here at phthalates, and we found other things. So we're still looking at that data. We also are pretty careful with our participants. We do report back when we're doing report back right now, and we'll give them a list of the product, what they found, what was in their biomonitoring data, and the list of products that they used. But we don't know that their biomonitoring data is necessarily linked to their product use, but we do talk about ways that in which what some of the things that they might want to reduce, they could swap out products, but we do have just a limited subset of products that we tested.
Just to expand on that, I would say in the exposed report that I noted that we did earlier this year with Women's Voices of the Earth that led up that effort, we did notice that we sent around about 20 products for testing, and their scientific researcher found that a lot of the ingredients that were listed on the products, once it went for testing, were not labeled on there. And so there was that disparity between what's labeled on the product or listed on there in terms of what was actually there. So there is that discrepancy. So we did see that. And these are, just to clarify, for salon grade in products for that report.
Thank you. And picking up on those responses, there's another question about even if people have kind of better information, so even if you got kind of better labeling, sometimes there's an assumption that that will be the answer, that kind of given better information, kind of people will be able to effectively protect themselves. And there was a question about cost differentials. And this is something I think, Bhavna, that you referenced a little bit in your presentation. Did you notice whether there was, or did you look for price differentials between products that either through labeling or testing were found to contain fewer harmful chemicals, and whether those ended up costing more than the products that were more dangerous?
So we haven't, in this study, we didn't document the cost of the products people were using. However, in another project we've been working on, we actually were looking at comparing things that were sold as natural and clean versus and benchmarking them to the price per ounce of products that aren't marketed as such. It's a little complicated to figure out how to do. The one thing we do know is that women shopped in our group. They shop at Target, they shop at the 99-cent store, and they shop then in a multitude of places: swap meets, Korean beauty stores in their neighborhood. So there's just a lot of different places people buy things. In South LA, where we're focused, there's just like not a lot of other places to go if you choose not to shop at Target, or your swap meet is there. A lot of people did buy things in their neighborhood, which was surprising. We thought people would be buying a lot of things online, but people still buy a lot of their personal care products in their neighborhoods, we found. So I think that swapping out things is hard when you don't have a lot of accessibility of a diverse type of product. So you may buy it online if you really like it, but people do look at cost, and the clean beauty price tag is higher, is what we've also found. It's neither defined, so clean is not defined, it's also more expensive.
Yeah, just to add on to that, yeah, in another study that we did, cost was another reason, what would they look for in terms of shopping and effectiveness. And so those two go hand in hand. So they wanted to be effective, but they also wanted to be, cost conscientious as well. And so that can lead into the problem in terms of selection. So are there, equity in terms of being able to afford cleaner products that come at a, may cost more in terms of resources for that. And so those are things that we intend to look for, to look at to see how we can address at the community level.
Yeah, and I will just add to that in terms of the importance of cost. And this was one of the reasons why in the Safer Beauty Bills package, there is language in there to have federal support for kind of new clean chemistry and to actually get some of that work funded, because that's one of the issues, is that it costs to come up with new formulations and ingredients that are going to be non-toxic and tested for safety. And so yeah, actually having some federal dollars to help get that work done is really important.
Thank you. Another question, which is, I think, an important one that just came into the Q&A is, did any of these studies ask participants if they have dermatological conditions such as psoriasis or eczema or allergies that could enhance the rate of absorption or increase exposure? So if you have kind of cuts on your skin, open skin, you could be kind of potentially getting more of the substance into your blood, into your body. Is that something that you're aware of? Has data been collected on that, either through your studies or kind of other similar research?
I feel like a toxicologist would answer this question much better than I can. I will say that people, that the beauty standards, these beauty norms, that if you have blemishes on your skin, age spots, eczema, acne scars, people tend to then think that they need to have even skin. This happens after pregnancy often, or as people get older, and they do tend to apply more products to those places to then achieve this even skin tone. And to combine this with another question in the chat, there are, if particularly mercury that Micaela was talking about, you're not going to see that on the label. It's not, you're not allowed to put mercury in products, it beyond a very small level, but we find them all the time, mercury, and it doesn't say mercury on the label. So I think there are many illegal products that should not be sold and we find in the marketplace. There is this claim that people are bringing them from other countries in their suitcase. This is not necessarily true. You can find these on Amazon, on eBay, pretty easily. We found lots of illegal products continually again and again. So I think we not only need to improve kind of new chemicals that are poorly regulated that we know about, parabens, phthalates, but these things that we know have good data on, such as mercury, are also hard to keep out of these beauty products. Astrid, you were in, I can't hear you.
Can you hear me now?
Yeah.
Okay, great. And to add on to that, yeah, as online retailers such as Amazon, we were a part of an amicus brief last year where there was a lawsuit, a civil lawsuit against them because of that reason, for the mercury that was contained in the skin lighteners, and the won in favor of the litigant that proposed that. And so now Amazon has to either, one, not sell these types of products on their website, or either they have to list that that it can be harmful in regards to reproductive or health, and have implications in regards to that. So it's kind of getting the way, but that's just one of very few cases that get brought forth fault in that regards. And so, yeah, oftentimes you're not going to see a lot of these products that are labeled that have the toxins or the ingredients in it.
Thank you. And there's a good question that was just put in the chat that I think ties a lot of this together. I'm going to ask it, take kind of a quick stab at initial answer from my perspective, and then I'm interested in everyone else's thoughts as well. But it is, can we speak to how these studies are being used or can be used to close the exposure assessment gap in risk assessment and to inform policy? Like, I mean, this is clearly important data, and we talked about kind of some of the deficiencies in how agencies assess exposures kind of at the outset. So starting just briefly kind of from my perspective, I think part of the complication here is jurisdiction over cosmetic products is actually, it does not lie with EPA, which is the agency that is conducting the risk evaluations for phthalates and many of these other chemicals. It is primarily FDA's jurisdiction. However, these are still exposures that anybody that's looking at the harm associated with any chemical needs to consider. Whenever you're looking at a chemical, you want to look at all the ways that people are exposed. And I think what research like Taking Stock and like the Beauty Skin Beep surveys do is they help replace some of those kind of unprotective default assumptions. Like when you know how many products somebody is using, when you have better information about the chemicals in those products and the kind of racial disparities in kind of how people are being exposed, that not only affects kind of your exposure assessments, because you now have data to replace kind of what was previously a gap in an assumption, but it also ties into kind of toxicity calculations as well, because we know that non-chemical stressors like racial discrimination and like housing insecurity affect how people respond to chemical exposures. You're going to be more susceptible to the same level of exposure based upon your non-chemical stressors, the lived kind of experience that you have every day. So knowing that information, kind of having that data, I think is really critical for risk assessors. But with that, I wanted to pose the question to all of you and to ask whether you've discussed your findings with any kind of, you know, regulators, policy officials, whether it's local, state, federal, and what the response has been, how, if you have kind of presented this data, have people kind of responded and potentially used it?
Can I go first? So I will say thank you so much, John, for mentioning about you know, the EPA versus the FDA, and also we've had quite a challenge when it comes to mercury in cosmetics. For instance, we have talked to pretty high up folks at the EPA and said, hey, you know, you need to support these sales bans, this, you know, proposed sales ban in the treaty amendment that's coming up for mercury in cosmetics. And they're like, we don't care about mercury in cosmetics, that's FDA, you have to talk to. But yeah, it's the same, much of the same mercury that's being used in like artisanal gold mining, that's also, you know, being put into skin lighteners and, you know, contaminating them with this neurotoxin. And so, and mercury, in from what I see it as a biologist, like mercury, the government should care, all organizations should care about mercury in a fish as much as they care about, you know, mercury in our beauty supply shelf. It's the same toxin. And so that's something that I would like really love to see more coordination among these federal agencies with these toxins.
I mean, I think the only thing I'll add is that the reality, I think, in communities is that the inventories that we have to create our own tools for doing better exposure assessment, I think is the punchline of the Taking Stock study. We don't know what people are using. The data on co-exposures is very poorly done and documented. And so we have to do this very upstream work to get to these downstream answers of why women of color have higher body burdens of these chemicals, have higher adverse health outcomes. And that work is onerous on the community. And it really could be picked up by agencies that have a lot, you know, more capacity, more funding, scientists that could take up these gaps and try to support filling them in ways that they can with the available science. I think that leaving it to community organizations and researchers who have to patchwork grants to do this work is really untenable kind of at the national level. We can share our data, we've shared it with DTSC. We've shared it in the state of California. We've shared this data. We've given talks, at the national level. We do lots of talks, but sharing the data and actually, kind of creating the space for agencies to take action when they can, I think are really important, when there are spaces to do that. And I think agencies are, people working in agencies could do more to support community work. And we hope to kind of have to do less to bridge that.
Now, I would say one of the biggest data gaps is that actually using the population as most at risk. Oftentimes these studies are done, as a subset, from us. And so you're not including the population that's actually affecting. So that's, part of the problem right there. And so as, using these opportunities to be able to find research around women of color or, individuals of color and how it affects us, I think is a step in a good direction, because you can't, know about, how to, go about this if you're not including those who are affected in it. So taking stock is a great example that illustrates this, where we're using, women, from Black and Brown communities and seeing how, our lifestyle and behavior use in regards to the products that we're using, and not just going off of, textbook like, communities and, other research that has not looked at this, from a BIPOC perspective.
Thank you so much. And this has been incredibly informative. And I see that we're at time. So I know there are some additional questions that we didn't get to. We'll try to follow up and provide answers to those if we can. But at this point, I wanted to turn it back to Rachel.
Great. Thank you so much, John, Bhavna, Astrid, and Micaela. Really appreciate the work that all of you are doing on these issues, and thank you so much for taking the time to talk with us about it today. And thanks to everyone in the audience. Thanks for your excellent comments and questions, and thanks for the work that many of you are doing on these same problems. So I'll just wrap up with some quick announcements. There will be a video recording of this presentation, and so you'll get an email with it within the next couple of days with a link to that recording. And I also want to tell you about the next webinar that's coming up. So next week on Wednesday, July 26th at 1 p.m. Pacific, 4 p.m. Eastern, the next Che-Alaska Partnership will focus on recent updates to EPA's National Contingency Plan for Oil Spills. We'll be hearing from the plaintiffs in a recent lawsuit that compelled EPA to update the NCP to incorporate new evidence on the effectiveness and toxicity of oil dispersants. And we'll put that link into the chat now. So thanks again, and Swathi, back to you.
Yeah, thank you to John, and thank you to all of our panelists, and for everybody for your active participation in today. So I've just got a last couple of things. So this webinar was co-sponsored by UCSF's Program on Reproductive Health and the Environment Science Action Network. So if you're a scientist, academic, or clinician interested in using your expertise to make meaningful policy change, you can fill out our interest form. Rachel will drop that in the chat. And for folks who missed it the first time around, we'll also drop the project website in the chat as well. And yeah, with that, I would like to thank all of you for joining us today. We really hope you found this discussion to be useful, and we look forward to seeing you on future webinars. Remember, this is a first out of 2 series. We also welcome your feedback on what other topics you'd like to hear about as part of this partnership series from PRI and Che. And as a reminder, you can go to the webpage for this webinar to look at all of the additional resources that I put in the chat and that the presenters gave ahead of time in the slides and resources section if you'd like to. So many thanks again to our speakers, to John, thanks to Che Director Kristen Schaefer for her behind the scenes support, and thank you to my co-pilot Rachel especially. But I hope y'all have a really great day.